So we're going to be talking about a lot of different things. But I see that your main concern right now is, I mean, there's a lot, right? But a lot of memory issues and a lot of concentration issues. Is that true?
That's my main concern now, but what brought me here was BPD symptoms that have been exacerbated since my last car accident.
Yeah.
So memory and all that is a part of it, but it's not what led me to you guys for this instance.
Okay, got it. So, and then I also see that addiction as number 2. What is it, mostly the marijuana right now, or?
Yes, I had stopped drinking for 4 years with, I mean, no cravings, no desire to drink, not a problem at all. And I couldn't really figure out or put my finger on why all of a sudden out of the blue, I started having cravings for alcohol again. I was going to make, I made 4 years alcohol free in August. I don't remember when I took my first drink again. I want to say it was somewhere around that time, maybe September, October. Not drinking to the level I was before, but again, it's just a weird thing. Like, why did this happen all of a sudden? And then I have been using marijuana in the evenings, which I have a love-hate relationship with it because it really helps my anxiety. It helps when I smoke at night. If I don't smoke, when I wake up in the morning, my heart is pounding. I'm nauseous. I can't eat. I have really bad anxiety. It helps me with my appetite, but it's just, I feel like I'm living a very dull life. I'm not myself, I'm not my energetic self. So, I put addiction down because I had the willpower at one time to stop drinking for 4 years. That was a huge deal. And I wasn't smoking pot then. So I'm a bit concerned about how that happened, wondering if it possibly could be a byproduct of my accident and my brain injury. I don't really know. But even though it's not a huge problem in my life right now, I really enjoyed my life better when I wasn't drinking or using cannabis.
Yeah. Okay. All right. So that will be able to go through the scans. Now, in terms of medications, have you ever used medications to help you sleep?
Yes, in the past. I mean, I've lots of natural supplements, but we even had a little run many years ago when we were working a lot with Ambien. Hated that. I'm traditionally not someone who likes to take medication. I've been through the whole amphetamine misdiagnosed ADHD thing. I've been on amphetamine since I was in my early 20s, and finally got off of those a few years ago.
Right now we're using pot to self-medicate. So in a way, we are using a form of medication. Now, it makes sense, and once we go through the scans, why we're radiating towards downers, because pot and alcohol are both downers. And once I show you in the scans, but I mean, those are pretty much the only questions I had. I think Melanie did a great job at getting a very thorough history. And with borderline personality disorder, what kind of therapy have you done in the past?
When I first heard about BPD and realized, I think there's 9 criteria, and then you have to have 4 out of the 9 to be clinically diagnosed, and I check all 9 boxes. So when I first learned that, I started looking into the dialectical behavioral therapy, no medications or anything like that. I did have a brief interval where I was on some anti-anxiety medication, which I really enjoyed. It made me feel incredible. My husband's sitting right here. I even got emotional because I was like, wow, this must be what it feels like to feel normal. But the side effects of that medication were just not something I could live with. So everything else has just been cognitive, mostly the DBT therapy. I do use an alpha stem device, the little electrodes on the ear for the cranial stimulation. I use a lot of mushroom tinctures, not the psychedelic stuff, like lion's mane, everything to just for calming my nervous system. But for BPD,
honestly, that's like the big picture here. And with BPD, there's always history of trauma. So most of the time, I mean, BPD is not treated with medication, it's treated with therapy. And that's dialectical behavioral therapy. But that's one thing. When there's comorbid anxiety and comorbid substance use, that's where medications come in play, or even supplements or something to take to help with the anxiety. Because what usually ends up happening is BPD patients can develop a form of PTSD. So when there is trauma in the past, the brain starts behaving like a PTSD patient, okay? Which is something that tends to be the underlying issue. Now, a lot of the things that I'm looking at have not really been treating the PTSD. So we'll go through it, and I'm going to share with you my screen so you can see what I'm seeing.
Would you increase the size here? Just go to the green. Yeah.
Can you see it?
Uh-huh.
Okay. All right. So the first thing that I'm going to go over with you guys is the total brain report. And you had something similar in one of your reports. But this is just more a more modern, practical way to explain it. So total brain, this is the test that you did in front of a computer. It's compiled with a bunch of different exams. This stuff up here, I don't look at it so much. I mean, although it is helpful, obviously depression coming up as the most severe. But when I see a risk of PTSD, that's where I start asking those kinds of questions, because trauma and emotional trauma is super linked with BPD. Okay. So if we don't treat that, we're just kind of running around in circles trying to treat the symptoms, but not treating the actual cause. Okay. Now, treating PTSD is not easy. And I say that with a very grain of salt, because the closer we get to those emotional wounds, the more it hurts. And the person would naturally just try to repel that unconsciously. Okay. So especially with someone with borderline personality. Okay. All right. So I'm going to put this smaller because I like to look at the big picture and see if we notice a trend. Okay. I'm going to annotate because I find it super useful. So this is scored from 1 to 100. Okay. I'm going to draw a line here. And ideally, we want all these little dots in the green area. Okay. Now, there are some in the green, but a few of them are in the red. Okay. So when I see that split, it makes me immediately go here and here. Okay. Now, what is this stuff? This is my ability to control stress, anxiety, and depressive symptoms. If you notice, anxiety is slightly even lower than depression. So it tends to be the big thing that we're going to be tackling. And we also see that in your scans. Okay. But keeping in mind that anxiety is a big umbrella and a lot of things fall under that, including traumas. Okay. So usually when someone has an ability to control their anxiety symptoms, we need to give them tools to learn to control them, one, but then two, we need to start finding out why are we getting these anxiety symptoms. And that's where the underlying trauma tends to be. Can you give me a second? Because my dog wants to say hi. Do you mind?
Okay.
When she hears me talking, she's like, can I come in?
Yes, of course.
Okay, come in. Say hi. You want to say hi?
Hi,
Okay,
buddy.
you interrupt me to say hi. This is Bella.
Oh, Bela.
Well, now
Oh.
Bella's a therapy dog. Look at that.
What a face.
She loves saying hi to everybody. And whenever I get with it always happens really weird. It's like she knows I'm in a new console. It only happens with the new console. With the follow-up, she doesn't come like yapping. Okay. She's the mama, and I have 6.
Oh my gosh.
Goodness.
Wow.
Yeah, she's the mama. Okay, yeah, you said hi. Good girl. Now go outside.
Well, that just relaxed me, so you can keep her around. That was great.
Yeah, I have mom, dad, and the 4 babies.
Wow.
Wow.
But she's so funny. But if I didn't do that, she was gonna be there for like 30
Right.
minutes.
The whole
Going,
Right.
like she wants to come in.
Not a problem.
All right, so we did that. So what I was saying, so usually the underlying issue tends to be a trauma, and that takes time to unfold because the closer we get, it's kind of like a wound, right? And the closer we get to it, it starts hurting more. So there's ways to get there, especially when there is BPD in the picture. Now, it's very common, which is why I started to ask you about your cognitive functions, how they have been declining. But if you notice, they declined after a traumatic event. So I wouldn't say that there is a physical assault to the brain, even though we're going to see it in the scans if there is one. But it was probably more of another emotional issue that happened where you felt something bad was going to happen to you. I mean, obviously, you were in an accident, right? People don't come out of an accident, even if it's very small, not feeling a little shook, okay? Even if it's a fender bender. So let's keep that in mind, as that was probably another traumatic event that triggered a lot of our cognitive issues, and a lot of our symptoms just kind of resurface.
Yeah.
Okay. So obviously this area up here, if we have issues with anxiety and controlling outside stressors, it's going to hinder my cognitive functions. Now, another thing that we find very useful in this test is a conscious negativity bias. And this is what Dr. Amen calls the ANTs, the automatic negative thoughts.
Mm-hmm.
And here we need some help. And why am I stressing this so much? Is because it's how we view things, people, the world, right? We tend to probably always go to worst case scenario thinking and not really thinking of the other side of the coin. And it's not being a positive or a negative person.
Yeah.
Don't get me wrong. It's more of like immediately our go-to is something bad.
Yeah.
Thinking. Okay. And that's a common way of thinking with someone who has been hurt before, or there's been traumas in the past, right? Like if a tiger is coming at us, our natural response is to turn on everything and run, right? But the tiger doesn't come to us every single day. But if we're always expecting that tiger to come, we're always in a hyper alert state because we're always expecting that big thing to come at us. Okay. So that's how I view negativity bias. So we don't always think of, oh, you know what? Everything is going to go good. You know what? When I meet this person, it's going to go great. This is going to be like a really good relationship, and really believe it, not just like tell yourself and then thinking that you're going to make yourself believe it. No, we need to like change that way of thinking, which is why I asked you what kind of therapies you've done in the past. Cognitive behavioral therapy, but trauma focused is usually my way to get that started. And I say that's to get it started because, so trauma focused, my next thing that I would do is EMDR. Have you ever done EMDR before?
No, but we're very well informed about it. And my husband and I both know, we just watched Dr. Amen's podcast with his colleague, psychiatrist, and got the online information to find a provider in our area. So yeah.
So I always want to look for someone who's trained in both, because once you are ready to transition into EMDR, that person is already trained. So you don't have to be looking for another provider. So I would look for someone who is trauma focused, CBT, right? So it's not just CBT, regular CBT, and keeping in mind that DBT is a form of CBT. Okay, it's just a behavioral therapy. Now, I would start going into the trauma arena, and then once we are ready, we will start to do EMDR. Okay, EMDR is a process. What are you going to say?
Well, I hesitated to ask because I feel like I already know the answer, but I have been in cognitive therapy for years. And I'm not, my husband and I were talking about this because before we found the Amen clinics, we were researching inpatient facilities. Like that's how in the weeds I was like, I need to go to a mental health facility that does trauma stuff, dialectical behavioral therapy. So I was ready to go somewhere for 3 months. That's how bad it was. So when I see this with that's what made me pause, because my husband and I have been therapized for the past 15 years. And I'm not saying that there's not a place for it, but my question is, if I've already unpacked my trauma, can I just skip to the EMDR? I just
That would
don't.
be for that person. That would be for that person to evaluate you, to see if you're ready to do EMDR. Yeah. So that's what I mean.
Yeah. Okay. I got you.
I would probably question how much unpacking we've actually done, because your scans show that there's still unpacking to be done.
It's funny you say that, because like I said, and that's why cognitive therapy for me, I'm like, ugh, because I've been through so much of it, and I realize how many of my therapists have probably done the best that they could, but how much I've really been failed over the past 15 plus years with cognitive therapy. So yeah, I do like this approach, but I'm not looking to sit on a sofa for a year and talk my stuff out again and again and again.
No. A year CBT, we need to move on.
Yeah.
That, I mean, that's just my logic.
Yeah.
But there's still traumas there that have to be unpacked, and I'm glad you used that word.
I told my husband,
what I would do is then I would find someone,
well, that's what you're reinforcing what I said, because I'm very, I'm like, oh, I don't need this. I already know my trauma. I've dealt with it all, blah, blah, blah. And then I had like 4 epic nervous breakdowns in my kitchen in the past few months. I'm like, well, maybe there's a place for talking this out.
There's definitely a place. But honestly, that would be for that person to evaluate you, and you tell them the same thing you just told me. You're like, listen, I think I'm ready to start EMDR. Do you think I'm ready to start EMDR? Because EMDR is actually really good for traumas. Okay. At the end of the day, what it does is it helps down this nervous system. So we're not always expecting this tiger. Okay. And it gives us a sense of calmness without being triggering, because I know someone who has trauma, when the calm is happening, that actually can sometimes trigger them, because they think, wait, there's always calm before the storm. So they have this way of thinking, no, for real. And I think you're laughing, you know exactly what I'm talking about.
We're laughing because it happens all the time. And
all the time.
Says you just don't, sometimes it would be in a heated thing. You just don't know how to be happy. Yeah, I don't. When things are well in my life, I have an amazing life, an amazing husband, beautiful. I live at the beach, literally the beach is right there. And I'm like, I just can't, when I feel happy and good, I freak out.
She's uncomfortable.
Very right. Can't be in my skin.
But that's a good place to be, right? So I want us to have a balance, because I also don't want us to go into the extreme of thinking, oh, life is great, everything is wonderful, I'm going to be like this forever. No, because that's not realities. Unfortunately, things happen. Accidents happen. Obviously, we don't plan for an accident to happen, right? But it's how can I learn the techniques that I need to know to, 1, keep my nervous system down, 2, not get re-triggered, and then 3, be able to be content and happy and stable at my normal, at my baseline, right? And knowing that there are dangers out there, but not every day am I going to face these dangers. Make sense?
Yes.
Yeah, I mean, the point we are now, like when I hear ice drop in our fridge, I think I go through a whole thing that someone's going to come in the house, slice my neck. I mean, I have horrible.
No, I know.
I take it far. When I pull up in a car side of me, I'm like, oh, they're going to shoot me. They're going to kill. I mean, it's all day long. There's a reel of something going on.
So let's go into EMDR, and then I have that person evaluate you to see if you're ready to do that. Okay. Now, if you need help finding someone, we can always help you too. We have a girl in our office. Her name is Crystal, and her job is literally to connect our patients to providers who are close to them, or the best that they have, even if it's through like this. I'm a believer that I'd rather get the best person, even if it's through a phone call, than see them in person. Now, some people prefer in person, so I totally understand that. But I just want us to get the therapy that we need, whichever way possible. Okay.
Now, EMDR can't be done via Zoom, right? You have to be in person.
Some people do it because there's other things that they could do. And that I've seen to be popular, especially with my international patients who, you know, they don't have these therapies in their countries, and they'll get them here. So I know, particularly in office in Coral Gables, who they have trained EMDR and they do it through Zoom. Yes, it's obviously easier and practical in person, but at the end of the day, for me, is like, let's get it done.
Yes. Okay. All right.
Okay. And why? Because this form of thinking down here controls this stuff up here. So if I'm able to bring this to the green, this would naturally come to the green without me doing anything else. Okay.
Okay.
All right. Let's talk about the scans. So first, I'm going to show you what a healthy scan looks like on the surface. And I'm going to bring up my little model here so we know what we're looking at. Okay. So SPECT scans. Well, what do we do with them? They really just tell us function of the brain. And it does it through blood flow and oxygenation. So the colors here don't mean anything. This is the surface scan. This is kind of like our thinking brain, the cortices, memory, cognition, focus, concentration, all that stuff. When you see a hole or a divot or like a reduced area, it's not that it's physically reduced or physically with a hole. It's just that there's decreased blood flow and decreased activity.
Gotcha.
Okay. Our goal is always going to be to increase the blood flow and increase nice, healthy oxygenation to the brain. And anything that is in the way of oxygenation, we want to remove from our lifestyle. Okay. So this is the underside view. So if we're looking at the brain here, it's looking at it from underneath. So if we're laying down in bed. Okay. This right here is the top side. So it's like bird's side view. So this is the right and this is the left. So right and left. And this is the right side surface. And here is the left side surface. Okay.
Mm-hmm.
And then we're going to compare it to your surface scan. Let me make it bigger. What do you think?
Yeah, I can see some significant differences here on the right-hand side. I look at the big space there.
Yeah.
Right.
Yeah.
So
Right.
believe it or not, is actually a pretty good surface scan. There are some areas that need help. However, is not where the money is. Okay. So the thinking brain. So let's start from the top. You see how it's kind of like pointy?
Mm-hmm.
So yours is a little bit flat. And you can kind of see it here, how this one sticks out a lot and yours doesn't really stick out that much.
Mm-hmm.
So this is the prefrontal cortex. This is the part of the brain that's in charge in planning, following through, focusing, impulse control. Okay. On the surface here, it's kind of bumpy. You see it?
Mm-hmm.
Like just kind of like, it's not crazy. It's a little bumpy. You see how it's kind of like jaggedy?
Mm-hmm.
As opposed to like, I mean, ideally we want this to be nice and round and smooth like an egg. Okay.
Oh,
And
wow.
then if you notice too, if we split this down the middle, the right side is a little bit smaller than the left. And actually down here is a little bit like punched in. You see it?
Mm-hmm. Mm-hmm.
I know you've had a few hits in your head, but I would probably say that it's kind of diffused. It's nothing like a traumatic brain injury or anything. I know you said you were diagnosed with post-concussion syndrome. And usually if that's the case, it's more on the internal part of the brain in the brain stem, not so much on the surface. However, the surface can get beaten up.
Okay.
Okay. The other part that needs a little bit of help are the temporal lobes They're a little bit, you see how they're supposed to be kind of nice and round like this,
Mhm.
and yours is kind of like smaller. And this is why you see it here, how it's not sticking out as much as it should be. Okay. And both the right and the left need a little bit of help, nothing crazy. Okay. So this, we tend to see it when there's brain injury, because even if it's mild, so the brain, it sits in the skull, right? And the
Mhm.
temporal lobes are underneath. You see, they're right here.
Mhm.
So it sits on this like hard shell. So it's very common when the brain gets hit on the top that it hits the bottom floor.
Mhm.
Right.
That's where the temporal lobes sit. So that's why it looks like there's been some brain injury. But again, nothing crazy, nothing really severe, at least based on this. What I do see with these little scallops, this we call these scalloping on the surface. This we tend to see in different toxic exposures. Okay, so I know you've had some labs done, but there's a few inflammatory markers that I would probably want to check. But anything that is a toxin, we need to be able to remove. Sugar is a toxin. So I know that's one of the things that we try to our patients to eliminate because it restricts blood flow. Caffeine is a huge toxin because it reduces blood flow. Now I wouldn't, if caffeine is a big thing, do you drink a lot of coffee?
No.
Okay. So then that's not at.
Mm-mm.
But then when I look at pot is a huge toxin because it decreases blood flow.
Mhm.
And it goes specifically to the temporal and the parietal lobes. And that's the stuff back here. So that could be that. Okay. I'm not saying it's only that.
Mhm.
We just kind of have to look through what are some of the things that we're putting in our diet, things that we are consuming that are toxic to our brain.
And many
And the
years
reason
of alcohol over,
Yeah.
using alcohol and amphetamines as well. So
Yeah.
yeah, I'm not
Yeah,
surprised.
all that reduces blood flow because it constricts the arteries. And honestly, anything that you smoke, even if it's just nicotine, it's going to damage arteries. So it's going to reduce the blood flow. So if you notice the overall shape or size, and I don't like to use the word size because we're not looking at anatomy, but the size of your whole brain is a little small compared to an adult. So what that is telling us is that overall, it has a reduction in blood flow. So we want to improve that blood flow, improve that oxygenation. This is why we stress so much exercise, for example. But if that's something that we're already doing, then my question is always going to be, well, what are we doing that is actually harming my brain? I got to remove it from my life.
Mhm.
The reason why I pointed out to the parietal and the temporal lobes is this is how dementia looks. But then I got to look for dementia causes. And if we have things that, like pot, for example, goes strictly to the same spots that dementia appears. So what ends up happening is it ages the brain faster over time.
Mhm.
So to me, it's a toxin that we got to eliminate. But then we got to see as to why are we consuming it? Why are we using it?
I already know the answer to that.
I know you already know the answer. So now
Yeah.
my goal is let's replace that with something that is actually helpful and not toxic for my brain. Does that make sense?
Yes.
Yeah.
Okay. So, and that's why we're here, right? Because I noticed that the brain in general, it's a little bumpy, but it's just very reduced in blood flow. So we want to improve the blood flow and improve the oxygenation. Okay. And that's plain and simple. Let me take a picture.
I have a quick question for you.
Yeah.
Don't mind. The
No. Please.
two upper right hand images, and it looks as if on her scan there is a pretty significant divot at the bottom of the brain.
Here.
Uh-huh.
Yeah. So the reason why this looks like this is because this is reduced and then this is reduced.
Oh, got it. Okay.
Okay. So the cerebellum, which is this little brain back here, and that's literally what it means. It's like the ancient brain, right? It's a little brain. It's like this. So this has the same functions as the frontal lobe. And those frontal lobes were planning, focus, concentration. We call these executive functions. So think of it as an executive in an organization. They look at the big picture, they plan, right? They follow through with the plan. They don't get lost in the details.
Right.
The cerebellum is kind of the assistant to that frontal lobe. So it does the same functions. In addition to coordination, movement, it's what allows us to be standing upright and not tipping over.
Okay.
It does that automatically. We don't think about it. We don't just like, oh, I'm falling, right? No, like our body just naturally does it. The same thing with walking. It's one of the things that cops test when people are intoxicated. What did it tell you? Walk in a straight line. If you can't, that's because your cerebellar functions have been hindered, there've been low functioning. And that's because alcohol goes straight to the cerebellum. So when you tell me that we have a history of alcohol use, our cerebellum makes sense, right? It's reduced. All we want to do now is remove those things and put new things that are going to replace it and improve oxygenation. But that's why this looks like that. Make sense?
Yes.
Okay. And please, I forgot to give you my disclaimer. I'm Cuban, so interruptions is not a thing. I don't care. In my family, we just talk over each other. No one gets insulted. That was funny to me when I started going to school here in the States, where I'm like, wait, I have to raise my hand to talk.
And your
So
dog
please, like,
as well.
yeah, she is, just doesn't care. So please, if you have any questions, just barge in. I'd rather you ask the question than not, and it'll be like, oh, I should have asked them that.
Mhm.
Got it.
Okay.
Okay. Thank you.
But to me, these are the areas on the surface that need some help. Okay. Some ways to do it. Let me bring up my little handy dandy worksheet. Did it pop up? No, it didn't. There it is. So temporal lobes. Well, we can start with the prefrontal cortex. The prefrontal cortex is this part here in the front. And like I told you, there's some decreased activity, nothing crazy. So people tend to have these kinds of issues.
Mhm.
Any of these ring a bell to you?
1, 2, 3, 4. I am empathetic and I am very ethical, but everything else, yeah.
So attention, planning, procrastination, impulse, and disinhibited, right? Now, what about these down here?
No, that's never really rang true with me. The risk-taking thing. I mean, I am spontaneous, but
Mhm.
never about anything that would be dangerous.
And remember, think of this also like as a spectrum. Maybe what we consider risk taking is, jumping off a cliff, bungee jumping, something like that, but it doesn't have to be that severe. Like compared to most people. Like, are you creative, out of the box thinker, curious with wide interests?
I'm definitely an out-of-the-box thinker. I am very curious, very creative. And as what you just clarified with the risk-taking thing, maybe that goes hand in hand with my clumsiness. I don't really, if I need to get up somewhere, I'm going to go. Ladder, I've had many injuries where I'm not thinking about the best way to do things, and then I'm hanging like a monkey from the garage ceiling, and in physical therapy, things like that. So that might look a little bit like that.
Mm-hmm. And that could be just being a little bit more impulsive and not thinking of everything through, right? And impulsive is a severe thing, right? Sometimes for some people to be constantly impulsive, but that could just be being, a little bit of a risk taker and painting my room blue. For some people, that might be like, oh my gosh, that's so much, right? But to me, I felt that was very risk taker of me to paint my whole office royal blue, right? So it's things like that maybe to others, it wouldn't be the same. Now, the disinhibition is where we tend to sometimes say or do things that I would like, I shouldn't have said that, or maybe I shouldn't have done that. And it just kind of comes out. I don't really think about it too much. Does that happen?
It happened.
He's back there going like,
that part of it for me, I would associate with what I would call my episodes, my BPD episodes.
Yeah, they are. That's where they come from.
Yeah.
And
Oh,
look what's down here. Because these, any prefrontal cortex issues is seen in BPD. So a lot of the personality disorders are going to have decreased activity in their prefrontal cortex. I mean, its function is what tells us, you know what, I shouldn't say that. It's kind of like the reins on the horse that stops us, the brakes, right? But if we don't have the brakes, we're just going to go.
yeah.
Right? So my goal is to help with the prefrontal cortex a little bit more. So things like HIIT training, like intense aerobic exercise, is really good for the prefrontal cortex. The prefrontal cortex loves stimulating active days. So when we retire, what major thing happened? We went from having a very busy schedule to maybe a non-existent one.
Right.
And that is triggering. That is not helpful for my prefrontal cortex. That's why I always tell my patients, I know sometimes you physically, like you have to retire for whatever reason, but never retire your mind and you never retire your activities. You got to keep going. If anything, this is the time to learn new things that I probably didn't get to do before and I didn't get to learn. Because we need to now reinforce those connections in our brain so our brain can actually grow in function, not deteriorate in function. And that's why our country is suffering so much with dementia, because we see retirement as now I do nothing. And it's like, no, this is when you have to crank it up and do activities, because if not, your frontal lobe is going to deteriorate.
Right.
Okay.
Got it.
So that's the kind of stuff we want to have. A high protein diet is also very good for the prefrontal cortex. Okay. A form of therapy that is not only good for the prefrontal cortex, but also for a lot of this stuff back here and the temporal lobes is therapy, oxygen therapy, hyperbaric oxygen therapy. That's something that I would recommend starting to at least look into. Okay. You don't have to buy a chamber, but you can go into one. A lot of places have them in spas because they're also good for hair, for skin, for beautifying the rest of the body. I mean, think about it. We're putting high pressure oxygen to all the tissues. And what causes cell death? Low oxygen. So
Now,
it actually helps with that.
Is hyperbaric oxygen therapy that, because like we have a little place here across the street, Degree Wellness, they have cryotherapy and all kind of other things, and I do oxygen there, but it's from just a little machine with the little thing
machine,
on my nose.
yeah.
Is that considered the same thing as hyperbaric oxygen therapy? No.
No.
Okay.
No. It's usually the alternative when the patient can't be inside the chamber for whatever reason.
Okay.
But the other day I helped one of my patients who is oh my gosh, word finding difficulties. He can't walk because he had a major accident, and we literally picked him up and put him inside the chamber, and he was perfectly fine in there. So there's a few people that can handle it. When I first went in myself, because I did have some mild scalloping as well, but for me it was a lot of caffeine because I was drinking a lot of coffee, a lot of coffee. And I'm trying to reverse that with HBOT. At first, it felt like, when you're getting off on an airplane and your ears are going to pop. It felt like that for about like 3-4 minutes. I thought my ear was going to pop and I was going to be like, okay, take me out of here because I can't bear it anymore. And then suddenly it went away. So my body got used to the pressure after 4 minutes, and I was in there honestly sleeping for about 40 minutes because it does give you this calming weird effect with the oxygen that it just kind of calms you down. And I sleep every time I go in the chamber. I sleep. I put in my AirPods, put on some music, and I knock out. That's usually my lunch break in the office because we have a chamber in the office. But no, it's not quite the same because the pressure of the oxygen, you can control it through the nostrils. Okay.
Got it.
But it's something that I would definitely look into, and it's not a medicine. It's not a pill. It's not something to take. We use it a lot in patients who have had traumatic brain injuries. And you can see the restoration of that brain tissue, and it's just incredible. Okay, I'll send you information about it, and then you guys look into it and see where you can get it done. And if you need a letter, if you need anything that is diagnostic from my end, I will obviously do that because I really seen a lot of my patients do really well with HBOT.
Okay.
So I'm a big believer of it.
And I'm not taking any notes. I'm assuming I'm going to get all of this. Well, we're recording the call too, but
You're not taking notes? I'm not writing anything down.
this document. No, let me take a screenshot then.
No, yeah, I'm kidding. I'm kidding. No, I'm gonna send you everything, screenshots, and then my report is gonna have everything in order, and written out and everything. Okay, I was just joking.
Gotcha.
Let me just mark it. There you go.
Oh, that's helpful.
Okay, let me erase all this. And then quickly, let's go to the temporal lobes, because honestly, I want to talk about the emotional brain. So the temporal lobes, we tend to have these issues in the temporal lobes. And these are the temporal lobes, the right and the left. Any of these ring a bell?
Check.
Yeah.
I don't have any rhythm problems, and my social skills, when I do this, I'm a bit of an introvert. My social skills are fine when I'm out, but I don't socialize very much. But everything else, check.
Yeah, so reading to me is because the left, if you notice, your left is actually a little bit more deficit than the right. The left is where we do a lot of reading and comprehension, not just reading like words, but reading faces, reading social cues. And that's why social skills are here, is because how are we able to read them? You know, how do we look at someone and they don't appear to us as a threat? Okay, that's a part of one of the functions of the temporal lobes. Okay. So things that are really good for the temporal lobes, honestly, HPOD is one of the places where the temporal lobe starts working the fastest. Okay. GABA is something that I recommend all my patients, especially when there is anxiety and when there's decreased temporal lobe activity. GABA is a natural chemical in our brain, and it's the most common chemical, and it's the only one that does calming and inhibits everybody else. So it literally just brings everything down without causing sedation. But that's how benzos work. Benzos work at the GABA receptor. So if we give the body natural GABA, we can even stop using pot because we don't need anything else. We just need GABA. Our body's asking for GABA. Why did you want to come in again? I'm sorry. Okay, come in and you're going to stay in. My goodness.
Taking too long.
What's wrong with you? So GABA is something that I usually start my patients when I see temporal lobes and when I see anxiety centers. And your anxiety centers are very active. We'll talk about it right now. Okay. But honestly, medications, I feel like I want to start these things first and eliminate like the pot, for example, before we start diving into medications. But honestly, even before I do medications, I don't even go into, changing or making anything on medications without doing a pharmacogenetic test to see how your body metabolizes medications. Because I can't just look at you and say, oh yeah, you can metabolize Xanax better than Lexapro. I can't. There's no, that's why we do genetic testing. And some people respond better to certain medications based on their gene and how they break down these medications. Now, most of the time, my patients, when I have them well and stable on supplements, and then they tell me, you know what, I'm at a good 80% improvement, I want to get to 100, then we can start looking at medication options. But when I do, I don't have to go to the high dose ranges because I'm already giving the body the ammunition that those medications need so they can work better.
Got it.
Medications, all of them, they work at the receptor sites. And receptor is kind of like the little gate that opens the chemicals to come in and out. But if I just give you the chemical, I can open all the gates I want, but if there's no chemical around for it to go in, then the medication is not going to work good enough. And then we're going to deal with side effects. So that's just kind of how I like to work and how I like to treat patients. But when the time comes, I will probably recommend a pharmacogenetic test before we even look at medications.
Okay.
Makes
Love
sense?
that. Yes.
And all that is a swab, or sometimes they'll tell you to spit into a thing and they'll run the tests. Okay.
Okay. Great.
So let's take a screenshot. You're not taking a screenshot. She wants to press the keyboard. What has gone over you? Why are you here today? She wanted to be here today. I don't. Usually she just comes to say hi and then she leaves.
And she's sitting right on your lap.
Yeah, she's just like, she's looking at the scan. She's so funny. All right, let's talk about now the emotional scan. And this is what it's supposed to look like. Okay. We call it the active view, but this is the emotional scan, is looking at the deeper structures inside the brain that are controlling our emotion, our mood, but it also controls a lot of circadian rhythms too. So blue is normal, healthy activity. It's not too much, it's not too little. Red is very active and white is hyperactive. We call this white hot. Okay. So ideally we want most of the brain to be blue. If you notice the cerebellum that we talked about earlier, we want it to be very active because it's kind of the assistant. It's always working behind the scenes. So we want this always on. And I'm going to show you what your brain looks like at baseline, meaning without working, without concentration. That's why we take 2 scans. What do you think?
Wow. That's all I can say. Wow.
Yeah.
Honestly, the only wow I would probably look at my cerebellum. It's almost off. So what does that tell me? I have low ability to control impulse, low ability to stay on task, to focus, right? Because remember, this does a lot of those functions at the prefrontal cortex that we talked about. It does. So we need to turn this back on. Now, one of the things you're going to receive is a year subscription to our Brain Fit Life website. And there's a lot of cerebellar exercises that I want you to do. Once you do those, we'll keep looking for more cerebellar exercises because I want us to strengthen our cerebellar functions. This is a cerebellar exercise. It's dumb. I know. But it's stuff like this. I know. I'm sure you can do that because look at your cerebellum. And believe it or not, if we strengthen that cerebellar function, it actually calms down the anxiety centers. Because this in here, this is not anxiety. This is anxiety. This is the thalamus. Okay. Now, I'm just showing you your baseline scan. This is how your brain looks like at rest, not thinking, not doing anything. But look what happens when we put it to work. Do you remember that test that you did pressing the space bar?
Yes.
And that was a very simple task, right?
Okay. Yes. Yes.
I mean, think about it. You were in a dark room,
Yeah.
no stimulus. Yeah, that person came in to put the tracer. So that could have triggered some, but you're still doing it for 15 minutes. So that shouldn't be enough.
I didn't even notice him coming in at all. He was like a ninja. I didn't even notice.
Yeah. Well, we tell them that they have to be like a ninja because during that test, you have to be completely focused on what you're doing.
Right.
But if you notice, it's one simple task. You're pressing the space bar for the letters. Don't press it for the X.
Right.
Yes, it comes at different speeds, and that's the whole point, right? It's testing how you are able to concentrate. When you do that, look what happens to your brain.
Oh, good God. Okay.
Very active. That's why when you said wow to the other one, I'm like, oh my God, I don't want to show her the other one.
And this is just with a little test. So this is now like when I think about my intense BPD episodes and the stimuli that I'm getting is like 1,000% more than pressing a space bar. So I imagine that my brain looks like a murder scene.
Yeah. So, however, look at your cerebellum. It turned on. So that's a plus. However, I want us to have stimulating focus activity without causing all this anxiety in the rest of the brain. Okay. But the nice thing about scans is that this is a picture of how we look now. This is not how we're going to look like in a few months.
Okay.
Okay. I mean, that's why we're here, right?
Yes.
So don't get hung up in the scan. I know is fresh and we have been anticipating these scans and I
Right.
know how that can be. However, we know that there's ways to bring that down, to bring all those areas back to blue, because we want nice controlled brain. Okay, we're going to go through all the pieces one by one. And honestly, it looks like a lot, but there's areas that I want to concentrate on. One of them is this, and look what happens. This was your thalamus. Remember in the other picture, it was still white. So in both states, the thalamus is my core. That's where I'm going to focus and throw all my tools at it. Okay.
Mm-hmm.
But there's these are called the basal ganglia. Okay. And this is inside the temporal lobe. So again, temporal lobes they need help, right? Which is why I stress so much about all the things that we can do with the temporal lobe. Okay. And then this monster back here, because it's pretty big. Well, there's two pieces. Hold on. There's this piece, and then there's this piece. This is the occipital lobe. And this, when we see it in connection with the limbic brain, which is all this stuff here in the middle we tend to see this in PTSD patients. And that's why I stressed that so much at the beginning of our conversation. Because your brain scans show PTSD. Okay. This part back here, this is the posterior cingulate gyrus. And this has, like everything in the brain, is pros and cons. One of the big pro is that we are emotionally intelligent. And a lot of people lack that. Okay. So having a really good emotional intelligence gives me perception into my emotions, my feelings, and very aware of that. And that also helps me have knowledge and perception and awareness of other people's feelings.
Mm-hmm.
So that's a huge plus. The problem happens is when that becomes overactive, that then we almost become obsessive with our emotions and our thoughts and our feelings, that triggers those attacks.
Right.
Does that make sense?
Yes.
Yeah, very much so.
Our goal is to bring that down, because I don't want the guilt, I don't want the self-sabotage, I don't want those feelings to be governing who I am. Right? I want Sherry to have control of the cingulate gyrus, of her own brain. Okay? And it is doable, is what I'm trying to tell you. I just got to point it out so then you know where I'm going at and why I'm stressing it so much. Okay? So there's a few pieces. See here? So this is all cingulate gyrus. The cingulate gyrus runs down the middle of the brain between the two hemispheres. And we call that the brain's gear shifter. And we call that the brain's gear shifter because it's kind of how sometimes we get stuck on thoughts, on emotions. Okay. So the brain's gear shifter, which is a cingulate gyrus, is where we can be sometimes flexible, meaning how we can go from one thought to another thought, or from one idea to the next. And sometimes allows us to go with the flow. Okay. It also does this thing called error detection. So what do you think is going to happen when we have a hyperactive cingulate gyrus? We get stuck. We have trouble shifting. And sometimes it's not just our thoughts, but trouble shifting with our emotions. We're not able to let an emotion go, and we get stuck on that emotion and not go to the next, not kind of like self-resolve it. Does that ring a bell?
Yes. Lots of bells. Is this piece that we're talking about in any way related? Like immediately when you said gear shift, getting stuck, I struggle intensely with noise, with like misophonia. Now I know the word of it, and it's bad for me. Like, is this part of that? Like if Bobby and I are sitting in the living room and the TV's on and he tries to speak to me, he has to mute the TV so that he can speak to me, because I can't even process 2 tracks of audio at the same time.
There's probably 2 things going on at that time. One is the stimulus of the noise that is just aggravating. That's one. 2 is how are we able to go from that thought to the thought of it's not aggravating. I can listen, right? But there's two different functions just there. One is the cingulate gyrus, the other one is the temporal lobes. Temporal lobes is literally, I mean, I always tell people it's next to the ears, right? So anything with sounds, anything with music, okay? I always am inclined to recommend different sounds that people can listen to bring down that hyperactivity. And at the same time, allows us to have those kinds of interactions that you just explained without it bothering us.
Mm-hmm.
Make sense?
Yeah.
But the trouble with going from, okay, this is why is this bothering me? Why am I stuck on that? That's the cingulate gyrus.
Okay. Because I mean, I am a person who, and I thought this was from my accident, you know, I've struggled with this for a long time, but it's gotten worse the past couple of years. But I travel with gel earplugs everywhere I go, just because I am just so hypersensitive to sound.
The
No, I
statement
can totally understand that.
is, if you don't mind,
Uh-huh.
if she's heard you chew, she's plotted your death.
But her brain is not helping her go through that.
Right, exactly right.
That makes sense. So to me, that when you said that, I'm like, yeah, of course, that makes sense. And our goal is to bring that down. Now, different ways to do that is cognitive behavioral therapy. I know you've had that many times, but it's those kinds of therapies that involve our thoughts and how are my thoughts able to shape how I'm going to behave, basically. There's different things too. Anything that is serotonergic, which is why medications that are serotonergic are really helpful for the cingulate gyrus in general. But instead of jumping to a medication, I would do 5-HTP.
I've got that.
Because 5-HTP makes serotonin.
Mm-hmm.
Okay. 5-HTP is a precursor to serotonin.
Mm-hmm.
So those are the things that sometimes when I start a patient on an SSRI, a serotonergic medication, I don't got to go to a high dose because I'm already giving it the ammunition that it needs so it can work better. Now, keeping in mind that serotonin is made in the gut.
Mm-hmm.
So if our gut health is not well under control, we won't be able to make as much serotonin that we need. Okay, just plain and simple.
Got it.
Okay. Cingulate gyrus also likes intense aerobic exercise. Omega-3. Okay. Do we ever find ourselves into a lot of this excessive error detection? Looking for errors, looking for mistakes?
Oh, you almost made me drop an F-bomb on that one. Yes. Yes.
And you know what, I see this a lot too, is so anterior is usually all these things, but with other people. Posterior is with ourselves.
Mm-hmm. Mm-hmm.
So I would probably be inclined to even go a step further, that we do a lot of excessive error detection within ourselves.
Mm-hmm.
About us, how I am, how I look, how I dress, anything. Right. And that's where that thing happens. When we get stuck on those excessive error detections in ourselves, it becomes a slippery slope into becoming obsessed about something or just getting stuck on that idea.
Right. And that's what happens to me. I'll get stuck on something, and then I'm just over it. But then that's how I'm living, not peaceful. I'm shifting from error to error to error, whether it's physical me, whether it's the house, whether it's something. I have to have something to fix,
Right. So we want to bring this anterior cingulate to a more calmer state. Okay. Because it's not about, it's about balance in my head, right? Mm-hmm. Saffron is really good for that too. But anything that is serotonergic, so there's different foods. I'm going to put the foods in the nutritional part of the report that are going to boost serotonin. Okay. Things like that we want to keep in mind, that we need to increase our serotonin production. Okay. Let me mark this. Because cingulate gyrus in the front and especially in the back.
And so I'm not sure if it's you or my integrative appointment coming up in February, but I have tons of supplements. I've been really
Yeah.
loving my mushroom tinctures, align mains and cordyceps and stuff like that. So who is going to tell me yay, nay, Sherry, if you take this, don't take this, or, anything,
So-
any protocol that you're suggesting?
Yeah. So the functional medicine doctors are going to be a lot better into kind of cleaning up, because I feel that we might be taking too many things, and then we kind of need to kind of clean up and be more focused.
Mhm.
Okay. So they'll be more helpful for that.
Okay.
I'm going to recommend a lot of the natural things that are going to be boosting the brain function and calming these areas. That's why I said GABA, 5-HTP, omega-3, things like that. Okay. Now, I did notice a few of the ones like ashwagandha. I saw it in one of the blends. I believe it's a blend, right? That you're using. Ashwagandha is great. Okay. But ashwagandha is something that we can just take on its own without all the other things, or, what I call the bells and whistles, and be more targeted approach. And I think that's why we're both here. This is why I'm here, because I look for targeted approaches, because let's face it, there's a lot of products out there. Supplements and holistic approaches is the new kid on the block, and everyone is making stuff. So I'm advocate of natural ways, keeping in mind that we want to make sure that these are supplements that have been tested, that the numbers that they're claiming that they're putting in the product is accurate. Like omega-3, we'll talk about this in a little bit, why omega-3, there's so many products out there, but we got to look at the actual milligrams of DHA and EPA,
Right.
for example.
600.
Yeah, high, 800, 900 EPA, because it does make a significant difference. And to me, I look for products that have been tested. Okay. And I know these simple things work. Okay. So I don't want to make things more complicated. If anything, I want to simplify, especially a lot of your supplements that you're taking. But they will be one to not only test, like the adrenals, for example, test your thyroid to make sure that what we're taking is actually going and helping, and not just it's another thing we're taking. No, let's clean it up. Let's simplify.
Right.
Does that make sense?
That my whole supplement saga has fallen into the error correction thing, because I have a lot of supplements, but then I get overwhelmed and I don't take any of them.
Of course, that's what happens to everybody. If we sit here and take 25 pills, guess what? We're not going to take them.
Right.
That's not practical. That's not realistic. So I always like to simplify, and what can I take that it either comes in a chewable or a powder that I can just throw in water, and it's not a pill.
Yes.
Okay. So that's my mentality. Okay. All right. So basal ganglia are these two, and they're both pretty active, but they really turned on during concentration. Girl, you're not uncomfortable.
She might need a SPECT scan so you can see what her issues are.
And I think hers is the basal ganglia, because she's a little bit anxious. Why not? What do you want? No, girl. I can't carry you all day. She's still here. All right. So basal ganglia are my anxiety centers. I call them the gatekeepers to the thalamus, because they kind of look like two little gates side by side. But this is the right basal ganglia and the left basal ganglia. So what do we tend to have? Obviously, anxiety, predicting the worst, tremors and tics. Okay. And when I showed you the scans, you made a lot of eye tics. And obviously that was anxiety provoked.
And if you
I showed
see my hands, you can't see my hands right now.
I'm sure. Okay. Now, the putamen is the little structure inside the basal ganglia that's in charge of motor related functions. So it's very common when it's a hyperactive basal ganglia for this putamen to go haywire, right? The nucleus accumbens is our pleasure box. It's literally a part of our brain that mediates pleasure, things that bring us pleasure, things that make us feel good. Okay, why is addiction right here? It's because it's all connected to the basal ganglia. So when someone is very anxious, they're more prone to use substances or do behaviors to calm that basal ganglia down. Hence, downers like pot and alcohol. because that brings down the anxiety level. But unfortunately, it becomes an addictive behavior because it does give us a feeling of pleasure because it taps into the nucleus accumbens. So our goal is to bring down the activity of the basal ganglia without affecting the pleasure box and also without creating another addictive behavior. Okay.
Right.
One of the things that I've seen to be very helpful is GABA. Okay. It's a natural substance, like we told you earlier, that works in the temporal lobes as well. GABA takes a good few weeks for it to notice a change. But in the long run, it is very relaxing and very calming. So is magnesium, and so is theanine. Okay. The GABA calming supplement that we have has all those things in it. So I'm always going to go to things that, what is the most thing that I can get in something if I'm going to take a pill. Okay. Otherwise, I don't want to be like a little here, like, no, that's too messy. Okay. Things like meditation is really good for the basal ganglia. Relaxing music, like all the time playing, is very good for the basal ganglia. There's different specific sounds that are good for the basal ganglia. So, I mean, YouTube is a great resource of free sounds that can be playing for like 20, 30 hours. Is ridiculous how
I've recently
people
gotten into the bilateral beats, which is incredible. Oh my goodness. That calms me immediately.
That's a little bit of EMDR, believe it or not.
Okay.
That comes from EMDR.
Right.
Yeah. So notice EMDR is here. Okay. So it's not just good for traumas, but it helps the anxiety center because it's it's connected. When there's trauma, there's high anxiety. I mean, PTSD is a form of anxiety. Okay. So that will be a place that I will start going even before I tap into any medication. But if you notice, benzos are here because they work within the GABA system. Like I told you earlier, benzos work at the receptor site for GABA. So let's just give the body what it needs, GABA. Okay. And this combination of GABA and everyday stress relief is a combination that we do when the person wants to start coming off pot without them noticing any withdrawals or any kind of activation, because as it is a downer, when we take it off, the person can feel activated.
Oh, right. Okay. If I just go one day, and I'm not smoking a ton, but I'm doing it every day.
I know.
So if I skip a day, I'm a cranky bitch. Like I just,
So ideally is we want to amp up the GABA so that doesn't happen. So when we are ready to say, you know what, let's start reducing it. Let's start bringing on the frequency. You just tell me when you're ready to do that and we start cranking it up.
I would be ready to start taking that immediately.
Yeah. No, GABA is amazing. I even have patients. I know of patients in Colorado, for example, that they're doing IV GABA, which I haven't done yet, but I'm really looking into it to see how my patients can respond to IV GABA.
Please keep me informed about that.
Yeah. No, it's really good. And then last but not least, the thalamus. And like I told you, it was the only one that stayed active in both baseline and concentration. Okay, so this is the deep limbic system, and that's this little guy right in here. And it does a lot of, I think of them as cyclical circadian things like mood, appetite, sleep, sex, right? All those things are very cyclical that go through our day. So the thalamus is kind of like the thermostat. It regulates those things. So of these, which ones ring a bell to you?
All of them, except the lack of smell.
Yeah.
All of them. No. Yep.
I thought so. Oh, no, not this one. Because the thalamus controls a lot of these things. It even controls our mood, that it can make us cyclical, meaning sometimes we're very high and irritable, and then other times we're just very low. And BPD patients sometimes get misdiagnosed with bipolar, but it's not bipolar, it's BPD, right? Because the elevation or the activation is just cyclical, and it's because their thalamus is very active. What happened? Did I say something that reminded you?
It's just I just been suffering with all this for many, many years. It's just nice to have,
Some explanation.
a match for,
Yeah, I
and
know.
a plan of action. It's been a long road.
I know.
No, these are
And
happy tears.
if I had $1 for every patient that I start with, that tells me almost the exact same thing.
Right.
Because we're not looking, and I'm so glad that we're doing this, because people are now seeing that the brain is an organ and it has its individual integrate, and we're not even looking at all the details of the brain because our imaging scans haven't gone to that level, but we are getting closer to getting even more information of how the brain is functioning and how we can help it even further. But isn't it crazy how just looking at these few structures, it like, to me, when I did my scan, I was like, so I'm not me. I'm like my brain. The thing that you knew about your personality, you're like, wait a minute. I thought that was just how I was. Like I had a patient today that told me, he's like, where I always isolate. I just always thought of myself as an introvert. I'm like, well, look at your thalamus. You have a very hyperactive thalamus. So you're gonna have an issue bonding and connecting with people at a deeper level. So what do you think is gonna happen to your libido? It's gonna be on the floor. Because
Yeah,
who
as a
wants
matter
to
of
bond?
as we speak right now, I mean, normally this is my bedroom, the lights are on, but normally, like right now in the upstairs bedroom, the shades are drawn, blackout curtains, red light. I mean, I love to be in a cave, dark. I know it's not good for me,
Yeah.
but it is the way I feel the most calm.
Yeah. And that's because the bonding center is in the thalamus. And your thalamus is hyperactive. We need to bring that activity back down. Okay. That's where I start adding things like tyrosine, because tyrosine is the precursor to dopamine. And dopamine is not just a pleasure hormone, but it's also, it allows us to stay focused, concentration. It's always linked with testosterone. So I always like to test women's testosterone levels, because if it's too high or too low, then it needs to be altered. Okay. Because that usually affects our dopamine levels if it's too low. Okay. Or if it's too high. It depends which way. It's just not, again, it's not controlled. It's not well regulated. And then we have problems with concentration. We have problems with focus. Not just having decreased activity in the frontal lobe can do that, but we have low dopamine. But dopamine, I like to start it probably a good month to a month and a half after we're good and stable with something that is GABAergic and serotonergic. Because I don't want this to be too activating that you might feel that, oh wait, my anxiety is getting worse. But it's like, no, I'm just having a little boost of dopamine. Okay. So I like to do it slowly, because I don't like for my patients to even notice anything drastic within a day or two. I like to go low and slow and take my time, because I don't want any crazy feeling. Because even like we talked about earlier, when you start feeling good, that could be triggering. I mean, I literally had a patient 2 weeks ago that she stopped everything because she was feeling good.
That would be me.
That would be sure.
And
Right.
she freaked out. She's like, doctor, I was well for like a week. So I had to be like, there's something wrong. And she stopped everything. So now we have to like restart everything again, go slowly. Okay. Because she freaked out that she was good. Because she hadn't been good in years. So that's why I like to do things in a stepwise approach, in a more calm approach. But then this is also why I like to over-explain things. And maybe because I was a teacher in the past, but I like for my patients to know where I'm thinking, where I'm going. So there's no hidden agenda. What I'm seeing, I'm just going to tell you. Okay. And I want you to be informed and more knowledgeable of your brain than I am. So that's why I like to provide all the information. And what I don't know, I'll ask. Okay.
That's
Okay.
great. Thank you.
The last thing that I do have to talk about is this in here. And this is called the diamond pattern. Have you heard of it? Through Dr. Amen stuff. This is actually a Diamond Plus, right? And this is what we see. Huh?
So that sounds great.
Well, this is what we see in patients with emotional trauma.
Oh.
And this is what I was telling you before, that I see in your brain trauma. I see the diamond pattern and the Diamond Plus, which is we tend to have a lot of that outward irritability, and that's what you call them into episodes. Okay. I mean, we see that when there's a diamond, when there's diamond plus, right? Because the temporal lobes, think of temper. So what gets me going, what can quickly irritate me is my temporal lobes. Okay. So the plus is because it's inside in the temporal lobe. And then I also saw what I told you earlier, the occipital lobe and this limbic connection here. We tend to see that in PTSD too. So that's why I said to you earlier, like, we haven't unpacked everything, because your brain is still acting like if we're having trauma. Okay.
Yeah.
Any questions?
And again, this may be for the functional medicine doctor, but
Yeah.
is the process after this, after, I start the supplements, get off of pot, make all the changes, do we regroup again with new scans and like, I know that I'm doing my labs in preparation for that appointment as well. I'm curious about my hormone replacement therapy, my thyroid medication.
I am curious about the hormone replacement therapy too, because sometimes, and I'm glad you brought it up, and then I'll answer your question. Because I've seen some therapies to be very beneficial and very helpful. And I'm talking about hormone replacement therapy for women. And then I've seen other ones where the patient just worsens. And I'm talking about the emotional part, the anxiety centers, the limbic part. So we need to kind of reevaluate that. And yes, that would be something to definitely bring up to the functional medicine doctor. Who are you going to be working with? With us, one of our doctors, or one of your doctors?
No, one of your doctors. I did want to sign the thing because my doctor is a DO. I adore him. He's very much in line with you guys' process, most of the natural stuff. But it's Dr. My memory, I don't know. Pate?
Let me see if it's already here. Registered.
Let's see. It is...
Did they already schedule your appointment? I don't see the appointment scheduled yet.
It's on February 7th.
And why is it not showing here? It should show here.
And it's Dr. I just can't remember his name.
I'm going to ask my assistant.
Because I would definitely, once we get some time under my belt where I'm doing some healing off of pot, doing all this stuff, I definitely want to reevaluate that as well.
One of my favorite evaluations is when my patient does a rescan, because then we can see the ones, honestly, this is a lot of information. There's a lot of things, these are a lot of to-dos, okay? And sometimes it's overwhelming, which is why I'm going to present to you everything in order and all that stuff. But my patients that stick to the T, you see a huge improvement, not only in their symptoms, but then you see it in the scan, which is so rewarding, because then okay, I've been doing the things I'm supposed to do.
And thank you for that. Now that I can articulate what I was trying to say. I am very well aware that our hormones, everything comes from the gut. So if you're telling me I'm doing all these things and I'm going to be healing my anxiety, that's going to be sending different messages from my gut to my brain, is there a possibility that I may be able to, change some of these other medications that I'm on? I'm just curious.
Yeah. That's always what I end up doing with all my patients.
Not
the brain and gut connection is, first of all, one of the most obvious connections. But let's keep in mind that the brain controls everything else, which is why we can't get a brain transplant. Or a skin, we could get skin grafts, but a full skin transplant, for example, we can't do. Those are major organ systems. So what I always tell my patients is we got to take care of the brain that we do have, and we got to improve it. And to me is, let's bring down the anxiety centers down, all this limbic brain down, which I know it is doable. Okay. And let's start looking at some of our lifestyle things to improve those other things too, which are actually lifelong changes. We can cure diabetes with just exercise. So why do we have to give you anti-diabetic medication unless you're insulin dependent, which is a whole different story. But that's an example of how we can make drastic lifestyle changes. And I think our Western world has not caught up to that. and we need to catch up to, let's do good lifestyle choices to live longer, but then also live healthy longer.
Yeah, and
Does
we
that make sense?
definitely, yeah, for sure. And that's one thing I think we're a bit ahead of the game. We are very active, 15, 20-mile bike rides, pool, infrared sauna, red light, all the things. So we're definitely,
Yeah.
in all
No,
that.
I know. I mean, I think that's why we're both here, right? I do the same stuff. Like, I don't see my patients until 10:30 in the morning, even if I finish later, because my whole morning is I go to the gym, I'll do the sauna, I'll do all the things I gotta do, because I gotta take care of myself so I can take care of other people. Because if my brain is not good and straight and sharp and solid, how am I gonna do what I do?
Right.
So I start my day with mindfulness exercises. I start my day with meditation, with prayer. Okay. I start my day with journaling, and that takes time. But you know what? To me, that's priority,
Mm-hmm.
because I got to take care of me before I can take care of my patients.
Exactly.
If this ear is not well, what am I doing here?
Right.
Right.
Does that make sense?
Yes.
So if we don't, we need to change that. And it's unfortunate how our country, I think, compared to other countries where I've been, we're so fixated on work, that we are the most anxious. We eat terrible. We don't take care of our brain. And what happens towards the end of life? We have a smaller brain with dementia.
Right.
No, let's reverse that. I mean, I look at places like Costa Rica, where people are the most common to live the longest in the whole rest of the world. Why? Because they eat everything that just comes from the land.
Mm-hmm.
They don't eat processed foods. I mean, one of the things that I love every time I go to Costa Rica is they have their markets every day. To them, it's not fresh market day. No, it's just that's how they sell their foods.
Right.
You know what I mean? And
Right.
whatever doesn't get used gets thrown out because it doesn't have preservatives. It doesn't stay fresh, because food is not supposed to stay fresh for a long time. You know? So it's all those things that we kind of have to learn from our neighbors to improve our lifestyle. And I think we are doing that. I think the US has woken up to a lot of those things that other countries have always done.
Mm-hmm.
You know, to me, every time I go to Europe and I eat a tomato in Italy, I'm like, this is what a tomato is supposed to taste like. I eat a tomato here. I'm like, what is this?
What is this?
This is not tomato.
Water, squishy, red skin. Nothing. Yeah.
Nothing. There's no nutrients. So
No.
yes, there's also that big, things that we're changing in our country, and I think it's slowly changing. But I'm glad that you guys are here. I'm glad I got to meet you today, and thank you for speaking with me. And I'll have the report ready most likely tomorrow, because I have to send it, and then my assistant is going to compile everything in an email, nice and organized. And then you're going to have a meeting with Melanie very soon, and she's going to go over the report. She's going to go over any other questions you may have. What have you been able to start? What is still missing? And then by the time we meet again in a few weeks, you probably would have already met with the functional medicine doctor, and they'll look at the scans too. So we'll all just work together. Okay. And I'll tell them my findings. I mean, they'll see it in my report too, but then I'll hear from them what are some of the hormonal things that I think also need to be looked at a little bit better.
Okay, great. Perfect.
Pleasure meeting you. Thanks so much.
You too. Thank you so much, guys.
You also have your assistant send me the download link for this call as well.
Oh yeah, no, it'll be in that email. And
Great.
download the video, because if you don't, it'll get deleted in like a week or two, because it's like
Okay.
HIPAA compliant, all that stuff.
Yeah, I'll
Right.
definitely do it. Well, this has been so informative. Thank you so much. Very grateful. Thank you, Dr.
Thank you.
Rodriguez. All right.
Take care,
Enjoy your
guys.
evening. All right. Bye-bye.
All right, bye.